All right, so obviously, as Andy said, I'm the Conservative MP for Peterborough. And Peterborough, well, Whittlesea, which is a town just outside Peterborough, which I'm sure you know is where I grew up. And I've always thought of Peterborough as my city. And so it's an enormous privilege to actually represent your home city at Parliament. I don't know how long I'm going to do this job, but it's the best job I'll ever have. It could be just 4 years, or it could be 24 years. Now, that's down to the electorate. I hope it's 24 years. And I'm going to try and do the best job I can possibly do for the city that I love and the city that I grew up in. But being an MP is obviously not just about representing your home city. You've got a national platform to talk about some of the issues that you care about. And many MPs, I feel, make a mistake by trying to do too much and talk about everything. Whereas I'm going to focus on 3 or 4 things which I'm particularly passionate about. And one of the roles that I've accepted as a Member of Parliament is to become the parliamentary chair or champion for the Conservative Disability Group. And the reason that I've taken upon this role is that I don't think we will reach our potential as a country, and Peterborough won't reach its potential if everybody reaches their potential. And I think far too often those who have disabilities or those with special educational need challenges don't reach their potential, or don't have the ability to reach their potential. There are too many barriers put in their way. And I see very much my role as the parliamentary champion on the Conservative Disability Group to try and champion those causes within my party, the Conservative Party, and at Parliament, and obviously here in Peterborough. And that's why I'm so pleased to be here to talk to you. This is why I support Andy and his efforts. It's not just the fact I've known him for 20 years. It's also, I think he does some absolutely superb work, and I'm delighted to be here. So just with that opening, I'll leave it to you guys to tell me a little bit about some of the how you felt during this difficult time.
So I'll start by talking about sort of the TV updates that Boris Johnson has done without the interpreters, because for all of my life I've been deaf. I've grown up deaf, and there's not ever really been accessibility with interpreters, and a few English subtitles, but we don't all know English that well, so in order to keep up with the English subtitles is actually really difficult. So really having the interpreter would be the ideal accessibility for me, not only during coronavirus, but this is sort of the national emergency, the crisis. So obviously when Boris Johnson's doing his regular speech or any important information is delivered, having the interpreter sort of even behind him or to the side, just so we can see him. Yeah.
Shall I just say something about that? I think I wrote to Prime Minister, or to Number 10, as parliamentary champion for the Conservative Disability Group about this very issue, that there were so many people who were missing out on vital information during these daily briefings because BSL was not offered as a communication. So I completely agree with what you said. I think there was a tendency from Number 10 and from government, as there always is, to push this onto the BBC and say it was their responsibility, rather than taking ownership of the issue, which in the way I felt that they should have. I think it would have been a very clear message and a very easy thing for Number 10 to do, to just own that issue and take it forward. And I regret that hasn't been done. But I will feed in, as I always will do, that I think it's a duty to any institution to really make sure that their information is as accessible as possible. And when Number 10 aren't doing it, then there's a real problem.
And also, there's another thing with Scotland having the interpreters behind the speakers, whereas England haven't. We all feel a bit gutted, to be honest, especially since Scotland have taken that.
It was a missed opportunity.
Yeah, I've been watching the BBC News and about sort of the issues going forward, and without the interpreter there, it makes me feel quite angry, to be honest. It makes me feel like it's not fair on us, and as deaf people we have a lot of difficulty, trying to lip read, and it's it's not easy. There's a lot of people with learning difficulties, and without knowing the full meaning, we can't hear what's going on. So it'd be really helpful for us to have that sort of equality and pick it up from an interpreter, so the information's really clear and we can prepare for what's coming in the future. Because obviously go through a lot of barriers, and we just find it really quite frustrating. And for myself, I felt really angry, and obviously it does affect people's mental health. It can deteriorate.
Well, I completely agree with that, because I think a lot of people have been isolated during this difficult time, even more so for those with disabilities. And we need to make sure that the information, their outlet to the world, especially when they're alone at home, is as accessible as possible. As I say, I think through the best of intentions that there was a push to try and make this a responsibility of the BBC, but that's not good enough, and it should have been owned by Number 10 during this process. I completely agree with you.
And I think also with the BBC, it's almost like we get it too late. We get the information much later than all the hearing people. They already know all the information, and we're sort of waiting until the evening, or at night we have to watch it when there's an interpreter available from the BBC. But I feel like we're always constantly waiting to hear what the next thing is.
Yeah.
And then secondly,
just on that, of course, it's an assumption that all deaf people are going to receive, or all those who need BSL are going to receive their information through the BBC. There are other channels out there that people may be watching, or may be viewing, to try and make this a responsibility, I think, of the broadcasters was a mistake.
Yeah, I mean, for example, especially if people are working, or they're working late, or they can't watch that one section where the BBC has the interpreter, it's really difficult. And it means, okay, I'll have to watch it tomorrow, or try and fit that in as well. And then the other example, when there's not an interpreter, it sometimes means that I haven't heard the information in time. So for example, they say it's starting from now going forward. I haven't seen that, and everyone's sort of preparing this, know that's to start now, but by the evening it's too late. I could have received a fine, or it could have really affected me. To be honest. It's just an example, obviously.
No, I totally agree. I mean, I don't think anything was deliberate. I think it was done, as I say, pushed to the responsibility of the BBC. It was done with the best of intentions, but as always, there were unintended consequences to poor decisions. And unfortunately, it's those with disabilities, or those who are the most vulnerable, that often have to pay for those consequences. I did write to Number 10 as chair of the Conservative Disability Group, and that is what I can do as that parliamentary champion, and this is why I'm so passionate about it, to ensure that we don't lose those opportunities, and it's not those with disabilities who have to live with the unintended consequences of poor decisions.
So I'll just give you like a real life example. And recently I had to go to hospital. I live actually in Lincolnshire, and I've moved to Peterborough recently.
Good man. A wise decision.
And me and my wife, we both sign, we're fully deaf. But one of the things we've been really struggling with is sort of to quickly get support in the hospital. So I've had to have an eye operation, and I had to have another operation in Lincolnshire. And the NHS have done a great job. I'm really pleased with that. But really, I mean, I always remember the difficulty in communicating, and it's constantly trying to deal with delays, or people not listening. But luckily, in the Peterborough Hospital, it was like the first time we actually had an interpreter. And I I think the whole time I was growing up, we've not had interpreters. It was never sort of there and accessible. And that's why a lot of the older generation, a lot of us, you know, we're either deafened or deaf. I think that's why we're getting a lot of problems now, and especially like health problems, because throughout our life or on TV, we're not actually available to access the information. And, you know, it can be quite dangerous, and it's sad to see. You know, we can't sort of ignore that or push that to one side. And I think the interpreters are so important, and without them, you know, that could save our lives, really, having them.
Yeah, I mean, David, you know, what you've really made clear to me in the last few minutes was how perhaps isolating and frightening it can be trying to communicate what you need, or at least receive communication from medical professionals, you know, at hospitals. And this is something that perhaps, you know, those who can hear don't appreciate. And it was really important for me to actually listen to that story. Just the other thing I want to say is, did you tell me that when you came to Peterborough City Hospital, you did have an interpreter there, and that made all the difference?
Oh, yeah.
Yeah, I mean, that was amazing.
And that was recently?
So that was the first time in my life. I think I moved here 2 years ago. And one of the reasons I got the interpreter the first time was because of the support from CDA, and trying to get the interpreter there, but that was the first time.
But just on your experience when you moved to Peterborough, and I'm delighted you have moved to Peterborough, so a very wise decision. But, you know, if you don't mind, what I'd like to do is to write to Caroline Walker, who's the Chief Executive of the NHS Trust, the City Hospital, and just say how well you found that experience, because it seems to me I'm always writing to her complaining and saying that this patient didn't get this, or this family didn't get this support, and it might be quite nice to actually point out to her, look, you know, the difference this made to David, to you, was considerable and well done, and make sure you continue that initiative and make sure that BSL interpreters are available.
Yeah, just I'll put in a little bit about the NHS as well, because before I was renting a house in a different place, and my GP always provided interpreters, and it was really good. And I really wanted to keep the GP, but they said, oh no, we have to move, because obviously we're in the local area. So I accepted that, and we tried to find, you know, GPs that were near me. And I registered, and I said, you know, can you provide interpreters? And they said, oh no, please can you find a different place? And I just couldn't believe it. I thought it was a little bit rude to me, to be honest, because it's NHS linked, and obviously they're doctors, they're GPs. And, you know, to have to sort of put up with travelling a little bit further to get my GP, who was really good at providing interpreters. You know, they provide them face to face. So it's not all GPs have that sort of like good experience or good knowledge about providing interpreters.
So why do you feel they asked you to choose somebody else?
I mean, I said to them, would you regularly provide an interpreter for me? Me and all of my family are deaf, and they said, oh no, we won't. And they just said it was better for me to find somewhere else.
Sorry, you had to find another GP? Oh, sorry. I thought they were suggesting you choose a different interpreter. Oh,
because they didn't want to provide me an interpreter. They said that they won't, and that really shocked me. So that's why I've sort of kept at the same place for years and years and years, but obviously travel a little bit further. But they always provide us with interpreters.
Yeah, I mean, I'd love to know where that is. I mean, if you ever encounter anything like that again, you know that is what an MP is there to challenge. And you know, I'd be very, you know, I'm shocked to hear that and appalled, to be honest with you. But that's what an MP is there to challenge.
That was about 3 years ago.
Okay.
So.
Well, if you ever encounter anything like that again, I hope you get in touch.
That's great, thank you. And, you know, I've grown up my whole life, and I always rely on my mum. I sort of use her, you know, like an interpreter from my doctor from the age of, you know, right up to sort of 13, 14, but obviously then you start to realise I don't really want to rely on my mum to do that, and obviously she's not a qualified interpreter, she just sort of signs basically for me. And I feel bad for relying on family members as well. You know, I want to be independent and to try and learn how to independently contact GPs, book interpreters and things like that. But so when I was just over 20 and I moved here to Peterborough, and I was trying to be independent. I'd asked the doctor myself, you know, if they could book an interpreter, and they just looked really shocked, and you know, they don't really know what that is if we ask them to book an interpreter because of our deafness. You know, my English is not very good for me, so we can't sort of rely on having notes back and forth, and I can communicate really fluently through an interpreter. But the doctor sort of says, you know, well, how do I find an interpreter? And I say, oh, I don't really know, you have to do it online. But I sort of said to them, could you book one as soon as possible? And they say, oh yeah, you know, I'll try my best. But I think it was a week or two later, I then came back to the doctors to try and book an appointment, and I was waiting so long. And I said to the doctor, have you booked an interpreter? And they said, oh no, sorry, I forgot. And I just felt like I really disagree with that sort of attitude, you know, to forget to book an interpreter, and they hadn't done it before, especially when I'd asked for it and made it clear that it was a need for me. That really made me frustrated and upset, and I felt like it was a waste of my time, to be honest. I felt like, you know, they're just not bothered and they were trying to avoid it.
Well, I would
I think that's just really difficult. That's the difficulty for me.
I mean, I would suggest that GPs and other support services within the NHS are probably well used to bringing interpreters for those who have English as an additional language or can't speak any English. And I think anyone who would want to use NHS services who didn't have English as a main language would be appalled to hear to have a similar experience to yours. And I think I don't know, Andy, I mean, is this a regular thing for BSL that you're hearing? Because I think if it happened with those who couldn't speak English, that would be a bigger scandal. And similarly BSL, okay.
I think probably my best recommendation would be like fire stations, police stations, things like this, you know, important places. If people were just trained, if the staff were trained about deaf awareness, so, you know, knowing that you have to provide an interpreter and things like this, then it'd be much easier for the deaf community, and then the staff would say, oh, okay, this person's deaf, I know the process, not for me to have to fight my way through it, you know. And I think, you know, it's just like a little bit of equality, really. I mean, hearing people arrive and they have a really smooth experience with these different services, they don't have to keep, you know, pestering them about booking an interpreter or this, that and the other. They chat and they have whatever they need sorted, and it's a much quicker situation as well. So for example, you know, a lot of my friends can hear, or they'll go with, you know, hearing families if they're deaf, but they can see that the hearing people have much smoother experience, and deaf people, you know, maybe their appointments are later or there's never an interpreter, and they just get all these delays when hearing people can just get on and do it. So really, I think that's where the difference is.
Do you think there is something I can do, perhaps, to write to GP surgeries in Peterborough, you know, in a very positive way, but just saying that I came here today, just saying, giving them a gentle reminder that they have a legal duty to provide this service, and they should see it as a similar sort of service to any other language barrier. I mean, would that be helpful?
Yeah, no, I really agree. That'd be great. And especially important places like Vlad was saying, you know, about doctors, surgeries and police, it's just a little bit of deaf awareness so that they know when a deaf person arrives. They say, oh yeah, that's what we have to do, we have to book an interpreter. That's really important. I totally agree with that, 100%. Yeah, that's right. And obviously, remember here in the UK, they've recognised BSL as a language.
Yes, of course.
So it means...
Same thing would apply.
It's official, it's approved, but what was that for if we don't have accessibility? You know, that's the point, is to try and get interpreters, and with the NHS and GP they have funding for the interpreters for deaf people, but I think they just try and sort of push it aside, but it is their responsibility.
Okay.
Yeah, and I think they try to avoid it, and they don't want to pay, and they just sort of try and say the deaf people don't need it, or, you know, we haven't had access for such a long time, and like Vlad said, all the hearing people sort of smooth and they don't worry about it, but I don't think they understand how it feels, you know, for the difficulties. They don't, or they'll say, oh, you know, we feel sorry that you're deaf. I don't want that.
Okay. Well, I think that'll be a good positive thing for me to do as a result of this meeting. I think, and I'd be very happy to do that. And write to let's start with GP surgeries, doctor surgeries, and see what sort of response we get. But we'll do it in a very, very positive way. But I'll say, look, it is a result of hearing the experiences of you three here today.
And we stay in contact with Andy to let him, so we can sort of find out some more information. Is that possible? So he can feed back some more.
Well, I'm hoping Andy's going to help me write the letter. And from there I'll obviously send Andy through any responses I get, and he can share it with you all.
I'm really, really hopeful that that'll be a really good process. I think hopefully that goes ahead.
Yeah, definitely.
There's just one problem with GPs. I think some GPs, are really good, and then others they'll say, we'll go and find a different one. But I think all GPs having the knowledge about deaf people would be brilliant. I think there's a lot of barriers there. So yeah.
Yeah, I mean, there'll be as in anything in life, there will be a variability in terms of their proficiency in this duty that they have. But it's important that people such as myself are able to talk about your experiences accessing NHS services in a bid to try and improve accessibility, and that's what I'm here to do.
And I think obviously here in Peterborough, it's not just us three. I think there's a lot of deaf people that live in. I think over 100 people. Roughly.
I agree with coronavirus. You've got a lot of people in Peterborough, and they go back close down.
And I think obviously I'm angry about the coronavirus as well. I think there's so many people in Peterborough that have been that it's been spreading. But for the deaf community, it's really difficult because obviously our deaf clubs have closed down, and we have to rely on Zoom, but it is really hard to have that sort of social face-to-face.
It's a tough time, and I'm acutely aware that during this difficult COVID time, it's fallen disproportionately sometimes on the most vulnerable because they rely on that social interaction in order to go about their daily lives, and also it affects their mental health and other aspects. So it's been terrible. It's been tough, but as always, it always falls disproportionately on the most vulnerable. And I just hope that we can get over this, because look, I think we are beginning to emerge from this crisis. I think some of the things that I've been hearing about vaccines are incredibly encouraging. Believe it or not, despite what you hear on the news, the R rate is still below 1, and the number of people who are contracting and dying from COVID is reducing dramatically each and every day. And so I think I'm still optimistic for the future. We just have to be careful about a second spike, because that is what will affect the economy and affect vulnerable people more. But we're through the worst. I'm very hopeful.
I really hope there's not a second wave. I can't even think about that. It was so difficult, and it'll be difficult for us again. So I think just a little bit back to normal, and obviously with things opening simply, I think that should be quite positive for us, hopefully.
I think when schools go back in September, and while I understand that the children themselves are not necessarily vulnerable, but I think once schools go back in September, that is going to be such a big step, and from that we're not seeing huge increases and huge spikes. That's the time to be hopeful. Also, believe it or not, again, you don't always see it perhaps on the news, that it's this country that is leading the way in terms of providing a vaccine. Now, it doesn't matter if it's this country or any other country, to be honest with you, as long as the world have access to it. But some of the things that have been happening from this country and the science and innovation strength we have is incredibly encouraging, and so hopefully we're then able to vaccinate the population and able to get back to a level of normality. But the numbers of people with coronavirus, believe it or not, in the country still is now relatively low. And the risks of contracting it through community infection, though very real, are certainly not as high. There are now as low as it's ever been, and certainly not as high as it once was in April and May. So we can feel positive about that.
Just one more. To talk about letting the GPs know and police and things like that. But just because you mentioned schools, I think a lot of schools aren't that aware of providing interpreters for deaf parents either. So it might be that the children are hearing, but the parents are deaf. And so for example, if the child gets in trouble, you can't rely on the child then to interpret for the parent, because the child could then be telling you a different story. I need to be talking directly for the teacher. But honestly, I know it's sort of laughable, but that has happened.
No.
One of my friend's sons have said, "Oh no, everything's fine. They've got home," and the son have sent him an email or something, and he's using interpreters to get that translated. And he's checked with his son, and then actually it turns out the son's been twisting the stories, but it's too late. Whereas if the interpreter was there, I think that's so important for us, for our communication. It's just the best sort of accessibility. And Lana's saying, yeah, I totally agree as well.
Yeah, I was smiling because I was kind of hoping that, I had that ability when I was in trouble at school, when I was, 8 or 9, be able to interpret what the teacher said to my parents. But look, it's an incredibly serious issue because, it's, again, it's about accessibility, and it's about ensuring, children are getting the best possible education that they can, and it's just another challenge that deaf people face each and every day, and it's all about accessibility, and I completely agree. In terms of what we do about it, I would just suggest that let's start with GP surgeries, see what sort of response we get, and if it's encouraging and it begins to make a positive difference, there's no reason why we can't increase that initiative or spread that initiative to schools. I mean, I promised to go to I tell you what I will do, Vladimir, I promised to go to every school in my constituency during my time as the MP, and we've done about a quarter, I think, so far. But every school I go to, I will mention this as an accessibility issue, and we'll see what the head teacher's got to say.
Brilliant. That's great.
Can I just say, look, it's been an absolute, privilege meeting you three, and because I always value meeting my constituents. But what you really have done is opened a window to an experience that I can't have, and it's always incredibly useful for me to hear of your experiences and think about what we might do to make sure that our public services and the things that quite honestly I take for granted, and many of us take for granted each and every day, are as accessible to those who rely on BSL and other forms of communication. So thank you for spending the time with me today. It's been incredibly helpful, and hopefully we've got one or two positive things that we can take from this meeting, and I just appreciate you giving me that opportunity.
I'd like to say thank you as well for coming, and thank you for Andy to organising it, and CDA, and obviously to give us a chance to meet you and sort of share these experiences. Hopefully that will improve the interpreter accessibility in Peterborough. That'd be
Absolutely.
great.
Wonderful. Thank you very much.